Hi everyone, it's Dan Jacobs here. So I just wanted to cover some of the coaching imperatives before we start analysing this athlete here who is squatting. We need to understand the problem first, then we need to free up affordances, and then we need to uncover and support effective attractors. What amounts to a skill? A skill comes from the global representations we have to enable us to utilise our capacities to complete tasks effectively. What amounts to a capacity? Structures and general function moderating the system response. In the side view of this athlete who's squatting, his feet are slightly splayed, on the right side more so than the left, which means that as he goes down into the squat, it's forcing his hind foot into valgus and giving him a pronated stance through his foot. And you can also see at the end of the low compression, his ankles collapse in. When looking at someone with straighter feet, you have more balance, so as a result he is putting more weight through his heels and he needs to have more weight going through his toes. So as this athlete rises up to the top of his squat, his toes come off the ground and his weight is at the back of his heels, and he should be actually driving through the toes. Just because of the stance and knee rotation he's adopting, his glute maximus and glute medius are going to be quite tight and sore and they'll need to be released. His shoulder droop, when looking at it from the front view, is indicating that he's struggling to lift efficiently. And his left leg also appears to be taking more of the weight compared to the right side. This can indicate that he's slightly stronger in the right quads and weaker in the left quad, and also slightly weaker in the left glute, which is fundamentally important when squatting. So what we're looking for at the lowest point of compression is the angle of his lower back. Is there increased lumbar lordosis? He does actually drop into lumbar lordosis when he is standing, but when he squats, he does have a nice straight back. Again, the weight is quite far back on his heels. So this is a lack of skill. So when comparing that athlete to this one has very, very tight hip flexors, and his back is dropping into increased lumbar lordosis when he reaches his peak load, which means he is actually using his spine in a very ungainly manner. In the right knee, at the point of maximum loading, his knee is internally rotating and it moves into valgus, and it's also visible to see the wobble in the knee. The left knee and leg is looking a lot more stable. His foot external rotation is more evident on the right side than the left. It's also important to look at his lumbar lordosis, and if you look at his head as he descends into the squat, you can quite clearly see it doesn't follow a straight line and there is a wiggle as it happens. The angle of the weight is also tilted down towards the right side, indicating a favour onto the left-hand side. This athlete does have an incredibly poor technique with this exercise in this squat. He is functionally weaker through the lesser glutes, and so he is driving up and fatiguing, making his right-hand side worse in terms of the internal rotation at the knee. It's also important to note that this athlete does have incredibly poor back posture as he descends into the squat. And you can see, obviously, with the weight lent onto the right-hand side, that his back is struggling to cope with this pressure. In order to rectify this, I would strongly suggest having deep tissue massage and release in across the hip flexors and all across the entire lower back into the quadratus lumborum, iliacosalis lumborum, to help improve the soft tissue around the back. So what this mainly will do is increase elasticity and flexibility and allow the athletes to have more capacity and capability to perform this exercise efficiently with minimal issues, much like the first athlete who's got the capacity but just a lack of skill to perform the exercise. Just to conclude on what we've seen so far, the initial athlete that we saw at the start is the better athlete out of the two in terms of performing this squat. Huge amounts of capacity, but needs to improve on his skill, whereas this athlete here has such limited capacity but could actually improve through massage and treatment in order to help him perform at his best. So just moving on to the next exercise, this athlete is a classic example of not having the capacity to perform this exercise properly. It looks as though he's never done it before, although he's controlling his back quite well. As this athlete descends down, his knees are bending way too much, which defeats the objective of this exercise, which is primarily designed to work the glutes and the hamstrings to a high degree. This athlete will potentially be feeling this exercise more so in the lower back due to the insufficient capacity to perform this exercise appropriately due to the poor amount of strength present. The gastrocnemius looks as though it's potentially very tight as he's not getting easy dorsiflexion through the ankle to perform this exercise well on either side. His right knee drops inwards, which could reveal the weakness within the glutes, as seen here. The athlete's left side is stronger, which is interesting to note as the individual is right-footed. This may be because he will be pivoting on his left foot and the right side is freer to move. His heels are coming off the ground rather than using the range from the ankle to facilitate the movement. Classically, with this athlete, it is a mixture of poor technique with huge amounts of weakness and capacity to perform this exercise efficiently. It is also very important to consider that this athlete hasn't performed this exercise before, and it is very important to be aware of potential injuries that could occur due to this dysfunction. It's also incredibly obvious at the end of this movement the hip thrust is non-existent, and this athlete needs to improve on this in order to perform the exercise smoothly. To help this athlete improve upon this technique and exercise, I'd strongly recommend working on trying to achieve a greater range of motion within the ankle joint, which could involve deep tissue massage and mobilization techniques to help facilitate this. Once this has been achieved, the next step could be towards improving on core strength and quadriceps strength to help improve on the movement, as one of the primary objectives in this exercise is to take as much pressure from the back as possible, as the glutes, hamstrings and quadricep muscles should be working the hardest during this movement. When looking at this individual, you can quite clearly see that the lower back is working too hard, as he doesn't have the capacity within the quadriceps, the hamstrings and the glutes to perform this exercise appropriately. When comparing that athlete to this one of the biggest and most obvious parts of this is the huge lumbar lordosis within the lower back. When this athlete is performing the movement, although you can see it is mainly coming from the back, he does have the capacity and potential to perform this exercise quite well, given the correct cues and feedback from the coach. The weight is quite clearly being held far too back through the heels, and the stomach is pointing outwards, which isn't the correct way to perform this exercise and could indicate a lack of skill. The speed at which this athlete performs the exercise is also way too fast, and if I was the coach of this individual, I'd be incredibly firm on him performing it slower because I don't want them to sustain an injury, but also because the desired outcome will be affected and they won't achieve the correct results. The shoulders are curved back into kyphosis, and this may be due to the arms helping to facilitate the weight rather than the quadriceps, hamstrings, and glutes. The foot posture of this athlete is massively different from right to left, which will provide an inconsistency within the musculature as well as an imbalance. The left shoulder is slightly higher than the right, and this could indicate a lot more of the work is coming through the back and isn't well skilled to working the necessary muscles as previously mentioned. In order to help this athlete improve upon their technique, it will be prudent to practice the movement with a lighter weight and go back to basics to improve upon the skill with the coach. This athlete does have the capacity to perform this exercise well, as we can clearly see there aren't any limitations or tightness within the joints or muscles. To conclude and summarise in comparing the two athletes in the second exercise, the first athlete struggled in all aspects and didn't have the technique, strength and bodily awareness to perform the exercise to achieve the correct outcomes due to limited muscular strength and abilities from a biomechanical point of view. The second athlete, as shown here, doesn't have any limitations or tightness but fundamentally lacked the skill in performing the movement properly. The lack of knowledge in performing the exercise can only improve with practice and correct cues from the coach, such as minor adjustments as well as visually imagining the perfect movement and watching videos to analyse what can be done better.